Today, I would like to mention about traditional implant operation and also flapless implant surgery operation with laser. Dental implant is a material which is being performed into the missing tooth region or totally edentulous region to have prosthetic crowns and bridges. The implant procedure is one of the best way for prosthetic rehabilitation of edentulous region. The main purpose of the implant implication is to obtain effective chewing and aesthetic considerations. Initially, I do measures of the bone volume in the missing tooth region in which the implant planning is made. In most of the cases, I do not use computerized tomography for the feasibility of implant insertion just because of avoiding unnecessarily taken radiation doses. I recently used special calipers and panoramic radiographs for the bone measures in the region for implant insertion. This general sufficiently for implant insertion. The traditional implant insertion requires gingiva cut through scalpels, means knives. After that, the elevation of the gingiva and exposing the bone then starts naturally bleeding. Subsequently, implant region preparation with the drills and insertion of it, which takes longer time. Besides traditional implant insertion operation, I recently used flapless implant surgery with laser technology. Under local anesthesia, gingival removal is being made with laser without bleeding in a short time. Then implant insertion is being made within 1.5 minutes. This is a very short period of time for the implant insertion. I can tell you this short procedure, the time between like you open and close your mouth. Post-operative period is very comfortable with this own technique. You may ingest your food easily as you wish without pain and minimally infection. The requirements of the antibiotic and analgesics will be decelerated with this technique. This operation technique is very good for the diabetics who has disturbed healing process. This technique also presents very good advantage to the cardiac patients who has generally use anti-aggregant drugs. I generally perform the flapless implant surgery with laser without any cut of the medical drugs, and these are all obligation for the patient's systemic diseases. After the implant insertion, the patient needs to wait for healing process, which is mainly about the bone implant osseointegration process. The implant and bone integration and also the healing requires time period up to 3 weeks to 2.5 months according to the implant quality. After this healing process, these crowns and bridges will be easily made on the implant. So you may chew as you wish, like your natural teeth. Time-consuming this kind of operations is being performed with no pain. You may easily be performed your implant in your lunch interval as well. The daily life is going on naturally without interrupting. happy and comfortable days. Thank you.